Yesterday on the show, we talked about an epidemic of prescription drug abuse among teens and the DEA's first ever nationwide prescription drug take-back. Today from 10 a.m. to 2 p.m. at 4,000 locations around the country, anyone can turn in old, unused, or excess prescription drugs that they have in their home, and there won't be any questions asked. Our website has received a number of questions about the take-back initiative, including just where those locations are. And joining us to answer your many questions, DEA Special Agent in Charge, John Gilbride, and our own Dr. Jennifer Ashton. John and Jen, great to see both of you this morning.
Good morning.
And John, I want to start out with you about this take-back initiative. What is it about, and why is the DEA doing it now?
Well, when you look at the numbers, it's staggering in terms of the number of people that are abusing prescription drugs. 7 million people abuse prescription drugs, and that's a 13% increase in just 1 year. And when you look at the number of teenagers that are abusing prescription drugs, it's frightening. 2,500 teens on average every day use prescription drugs to get high for the very first time. So Operation Takeback is a chance to get those drugs out of the medicine cabinet where they're just sitting there waiting to be abused.
And Jen, as a doctor, how rampant is the abuse that you see in your own office, and what is the seriousness of it? Because I think a lot of people miss that point in all of this.
Well, I think we don't really know how rampant it is. Those numbers we just saw are just really estimates, and the fear in medicine, in clinical medicine, is that they could even be worse. I think a lot of people fall into the habit of use, abuse, and dependence on prescription medications because they're lulled into a false sense of security that if a doctor prescribed them, they must be safer than recreational or street drugs. We know that is not true.
Given the size of this problem, the fact that it may even be bigger, is there something doctors should be doing, in your opinion, differently?
Well, I think there are two things, Rebecca. The first thing that doctors should do when you're treating a patient with chronic pain, because a lot of these are prescription opioid narcotics for pain syndromes, is what we're taught in medical school. The right dose is the dose that works. So many doctors are afraid of undertreating because they don't want to make the patient into an addict. And then what that does a lot of times is it drives that patient to other doctors to get more and more of the same class of medications, and then they can fall into a habit of dependence and abuse. The other thing that doctors can do, Rebecca, there's a new urine test that's available for doctors that can really delineate what specific types of drugs is the patient taking. It comes out in their urine. Before, we would just find the patient's taking opioid narcotics. Well, does that mean Percocet? Does that mean codeine? Does that mean Vicodin? Does that mean Dilaudid? Now a doctor who suspects that a patient may have a drug abuse problem can actually see how many drugs that patient is taking and know if that patient is in trouble so we can intervene.
That's useful information.
Absolutely.
John, what other partners is the DEA working with, from doctors to parents, to get this message out and to really put an end to it?
We're working with everyone. We have, as you mentioned earlier, 4,000 sites throughout the country today, and we're doing that in conjunction with our treatment and prevention partners, police, community groups. From the Rose Bowl to Grand Central Station, we're out there across the United States to collect these drugs, and it really, truly is a nationwide collaborative effort today.
And it's a huge effort. I want to let people know, John, where they can find this information. Please tell us.
Anyone that needs to find a site, go to www.dea.gov. There'll be a link, Got Drugs. Click on that link, put in a zip code, and
you'll find one nearby.
The nearest site will show up.
4,000
spots.
We really appreciate it. Thanks so much, John Gilbride and Jen Ashton, for being with us this morning.
Thanks,
Have a great weekend and good luck with the initiative.
Thank you very much.